Severe lower back pain during period. Causes of low back pain during menstruation. Low back pain during menstruation usually occurs in the muscles and is caused by hormonal changes. Prostaglandins are chemicals produced by the female body that cause many symptoms associated with menstrual discomfort. The tissue that lines the uterus produces these chemicals. They stimulate the contraction of the uterine muscles during menstruation to shed the uterine lining. Prostaglandins also cause menstrual cramps and pain symptoms. Strong contractions can lead to lower back pain, as the pain can spread from the lower abdomen to the lower back. Women with elevated levels of prostaglandins may have severe menstrual cramps and back pain during menstruation. Severe lower back pain during period, signs of period versus pregnancy. Although menstruation and back pain go hand in hand, low back pain can be a symptom of early pregnancy. Some women can also have it before they miss their period or before a positive pregnancy test. The ligaments in your body can cause pain in your lower back because, by their nature, they soften and stretch to prepare you for labor. This can put pressure on the joints in your lower back and pelvis, which can lead to lower back pain. You may have low back pain during early pregnancy around the 4th week of pregnancy. This pain can last for weeks or months while you are pregnant. Symptoms of low back pain during pregnancy may be associated with other signs of pregnancy, such as a slight spot or bleeding, nausea, and breast tenderness. Symptoms of low back pain during pregnancy may be associated with other signs of pregnancy, such as a slight spot or bleeding, nausea, and breast tenderness. If you know you are pregnant and have symptoms of heavy vaginal bleeding or watery discharge, see your doctor immediately. If you have a history of early miscarriage, it is especially important not to ignore these signs and symptoms. Eat healthy and nutritious food. Maintain good posture to relieve back pain. Stay active to strengthen your back muscles. Apply heating pads and gently massage painful areas to reduce pain. An ectopic pregnancy can also cause colic and back pain. In this situation, a fertilized egg attaches itself to the outside of the uterus, for example, in the fallopian tube. Symptoms include stomach cramps, low back pain, abnormal bleeding, nausea, and shoulder pain. Some women may have early signs of breast tenderness and nausea in early pregnancy. Lower back pain before period, should you be concerned? What do they refer to? Abdominal pain after menstruation and lower back can be due to the following reasons. Ovulation. You may feel low back pain after menstruation, with cramps, during ovulation, when the ovaries release an egg. It occurs in the middle of your menstrual cycle. Ovulation pain can come on suddenly. It can last up to 2 days. You can improve on your own. Endometriosis. With this condition, the tissue that lines the uterine cavity implants outside the uterus, usually the ovaries, fallopian tubes, or the tissues that line the pelvis. Endometriosis can also cause low back pain before and after menstruation. Besides spasms and low back pain during menstruation, other symptoms of endometriosis. Adenomyosis. With this condition, the tissue that pulls the uterine cavity grows and enters the uterine wall of the muscle. It can be painful during and after menstruation, with prolonged or heavy menstruation, pain during sexual intercourse, and blood clots during menstruation. Cervical stenosis. With the condition that some women suffer from, the opening of the cervix is so small that it prevents the clearance of menstrual blood. As a result, there is an increase in uterine pressure, which causes menstrual cramps and back pain. Your doctor can treat cervical stenosis with medicine or surgery. Pelvic inflammatory disease, PID, it is an infection of the female reproductive organs, usually caused by bacteria. Apart from low back pain after menstruation, other symptoms are abnormal or heavy vaginal discharge, bleeding or pain during sex, fever with chills, difficulty urinating or frequent urination, abnormal vaginal bleeding, pain when defecating. Pelvic inflammatory disease can be treated with antibiotics, and sexual intercourse can be avoided for a time. How can you deal with severe lower back pain during period? Eat a healthy diet, avoid smoking, exercise, heat, hot bath or bath, massage, relaxation, hormonal contraception, drink enough water, avoid foods that contain salt and caffeine, avoid alcohol. Back pain during periods home remedy. One. Hot and cold technique. Place a couple of ice cubes on a towel until it reaches a reasonably cold temperature. Apply to the affected area and apply pressure for about 20 minutes. Subsequently, moisten a towel with warm water and leave it to act for 20 minutes. Keep in mind that it is important to know if your back pain was caused by some type of injury because heat can increase inflammation. Two. Massage. You will only need coconut oil, rosemary oil or sandalwood. It is advisable to clean the affected area to better absorb the product. This will help us reduce stress, relax muscles, activate affected nerves, and reduce inflammation. For the pregnant woman, avoid massages with alcohol or rosemary oil, as they are contraindicated during pregnancy. 3. Horse chestnut infusion. A natural way to strengthen the back is with an infusion of horse chest, typical classic pills in cold months, which we must take every day to achieve a better effect. Heat 200 ml of water and when it boils add 3 drops of horseshoe extract. 4. Monk infusion. Sedge leaf has relaxing properties. To take advantage of them, it is recommended to drink 3 cups of infusion a day. Thus, heat a liter of water and add 2 tablespoons of sage, 20 grams. Let the decoction rest for a few minutes, strain the content and drink it. 5. Vitamin C. Vitamin C is very effective in relieving pain. Why? Thanks to its antioxidant properties, we can reduce inflammation. Additionally, vitamin C contains collagen, which helps to strengthen cartilage and tendons and, as a result, prevents wear and tear and back pain. Vitamin C can be obtained from citrus fruits such as oranges and lemons, kiwis, strawberries, guava, and broccoli, among other foods. 6. Improve posture. One of the foremost common causes of back pain is poor posture. This can happen while walking, sleeping, or sitting. To find out if we have a bad posture, we will stand in front of a mirror and hypothetically divide our back into two parts. Shoulders, hips and knees must be at the same height. To correct bad posture, we can use the waistband or yoga and Pilates, in addition to exercise. 7. Take a break. Most people who at offices use their mobile phones and computers for an extended time. Especially if the posture is not very correct, they suffer from back pain. The same goes for the other extreme, who spends a lot of time on their feet. In either case, try standing up and doing stretching exercises. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.